Hi there, welcome. I'm Cassie Cannon, licensed clinical psychologist. That's Motley Crue taking his usual nap. I am a EMDRIA approved consultant, and I am also approved by the APA as an approved sponsor to provide continuing education courses. And I wanted to talk a little bit today about target sequencing in EMDR. And you may have seen a previous video on target selection. I recommend you also watch that one. But the purpose of sequencing in EMDR is to choose the correct order in which you address targets in EMDR. Quick refresher, you may have just come out of your EMDR training, and they often are focused on just the standard protocol and how do you appropriately process an EMDR target. And we really want to help you with target selection and sequencing and how that fits into your entire master treatment plan. Again, phase 1 and phase 2 is preparation for your EMDR target. So, anyways, today wanted to talk to you a little bit about how do you sequence or order those targets that you've already identified as a part of your client's master treatment plan. So the main overarching thing to remember is that when you are doing EMDR sequencing is you want to do the past events, past targets, then the present triggers, and then future templates. So past is the events that happened previously. The present triggers are the current events that activate the client currently. So it could be someone that looks similar to a perpetrator. It could be the sound of someone's voice. It could be any number of things. But in your target selection, you should have already collected that. Or after you finish your past targets, you might say, what are the things that currently bother you now? Because that might have changed. And then once you do the present triggers, you then do the future templates. So you are preparing your client to embody a positive belief about themselves as they encounter a trigger that would normally bother them. So that is really important, that you're doing the past, then the present, then the future. There's some rare scenarios where you might do some future templates first. One might be if you just don't have a lot of time with your client. The future template could be helpful to help them prepare for something where you just haven't had the time to be able to do all the past and the present triggers. But generally, you're going to do the past, present, and then future prongs. There are a couple other ways to sequence, and I want to give recognition to the EMDR clinicians who have published their material. Obviously, Shapiro is the person who has really focused us on the past, present, and future. There's something called the two-method approach, and this was first referenced or documented by Jongh and Broeke and Meijer in 2018. And this is kind of two separate ways that you can sequence. One is addressing the symptom. So you choose the symptom cluster to address first. And then they have you timeline the events or the targets. And then you choose the first target and then the target when the symptoms rapidly increased. So under this two-method approach, one method is addressing the symptoms. You're doing the first event in the symptom cluster and then the one that immediately preceded the increase in symptoms. A lot of clients can tell you that. Again, you likely will have collected this in your target selection. So you should already have the targets that you're selecting from, and then you are sequencing them in these ways. And then, of course, any other present triggers, you're going to process that, and then future templates. So all of these are going to go past, present, future. The other method with Jongh, Broeke, and Meijer is the addressing negative beliefs. And I love doing this one because a lot of people can just tell you the negative beliefs that they just notice popping up in their self-talk. So you would first identify the worst core belief, or the one that's driving the symptoms the most. You then will have identified the traumas that prove the belief that it's true. And then you're going to begin with the trauma that proves the core belief the most. And so you don't go chronological in this one. It's which memory, which event proves the most that you're worthless. And then you just go in order of the worst. And again, remember that with generalization, previous memories that had a lot of energy oftentimes don't have the same amount. So that's the 2-method approach. Another one that could be really helpful, and this is by Kitchur. Hers is the strategic developmental model. This one could be just for the person who's just, I want to just get it all done. Some people come and just want to address certain symptoms. Other people just want to get it all done. So this is going to be more likely for this person, but for her model, the strategic developmental model, you've already put everything in chronological order, like the big targets. And then you do the middle childhood first. That's going to be 4 to 11 years old. Then she recommends pre-verbal, and that's under age 4. And that's because clients are more vulnerable during this processing. So not really recommended to do that first. So that's why she recommends middle childhood, then pre-verbal, so under age 4, and then adolescent and adult targets, and then present triggers, future templates. And then this model was recommended to me by my consultant. And so this is the one I use a lot. And the reference that I've been able to find that really lays this out is Andrew Leeds in his book. It's the Guide to Standard EMDR Therapy Protocols for Clinicians, Supervisors, and Consultants. And he calls this the Symptom-Informed model. And I haven't been able to figure out if he is the person who identified this model, or if someone else did. So if you know, comment. That'd be great. I'd love to know. But the recommendation for the symptom-informed model is you identify the symptom cluster, and everyone's different. Some people all do clusters of types of abuse or a negative belief as the cluster. And then you do the earliest or first incident, then the worst incident, and then the most recent incident. So let's say we're targeting physical abuse. Earliest you remember, the worst you remember, most recent or the last time it happened. And then you have them scan back. Are there any other memories that have charge left? And then you'll do those. A lot of times, the earliest and first, the worst or the most recent, clear out a lot. And things that used to have energy, again, don't, or there's not that much left. And then again, you do the present triggers. So the look on someone's face, the sound of someone's voice, particular location, whatever it is for your client. So present triggers, and then future templates. So I have these laid out in the EMDR target sequencing plan handout. You can go to my website and find that. I hope this was helpful for you. Also, I do have a 2-hour self-paced CE course that you can earn APA and EMDRIA credits on target selection and sequencing, a little bit about how that fits into the entire master treatment plan, but the bulk of the CE is on selection and sequencing and trying to help you see how that would fit with more complex cases. I hope this was helpful. If you have any questions, just reach out.